Hello, and welcome to this week's broker training, part of our selling skills series. And this day, we're talking about how to conduct a successful sales seminar. My name is Erin Ackenheil. I own Black Point Insurance, where we help Medicare beneficiaries learn about the A, B, C's, and D's of Medicare. And we help agents and brokers nationwide learn to launch, grow, and retain their businesses. We like to conduct periodic trainings to help brokers and agents learn how to be more successful out in the field and grow their business very successfully. So this is part of our selling skills series, and we welcome you here today. So we have a full agenda. The first thing I'm going to be doing is a Black Point commercial, just talking about who we are and what we do and how as an agent or broker, you might be able to grow your business successfully by partnering with us. Then we're going to talk about preparing for your seminar. So it doesn't just happen on game day. What do you have to do to be ready to successfully conduct your seminar? Then we're going to talk about actually conducting the seminar and follow-up skills. And then we'll talk about questions and answers and next steps. Today's training is going to take about a half an hour. It's also going to be posted on YouTube. So be sure to subscribe to my channel so you always can be watching and seeing all the latest trainings. And you can kind of refresh and make sure you've got all those points to help you build your sales seminar. For now, let's go ahead and get started. So Black Point, who we are and what we do. So what happens is when you're in the Medicare world, you can contract with a variety of different insurance companies to represent their products, but it's a very cumbersome process doing individual contracting. There's not a lot of support or guidance. You're kind of on your own as an independent entrepreneur. There is definitely an alternative, and that alternative isn't always created equal across all the different partners. But how it works with Black Point is we work with a larger organization, an umbrella organization called Van Berg, which is a field marketing organization or an FMO. And then we, Black Point, are a managing general agency under that umbrella. Now, what's great about working with Black Point is if you're an agent or broker and you need to align yourself with someone to help you and make this process very seamless for you, you retain 100% of your commissions in your pocket. And we are just there to help support you and grow your business and be that lifeline when you're out there trying to be an entrepreneur and be successful. Now, what happens is you see there's all these different insurance companies that are out there and many more. And what happens is Van Berg holds that key contract, that FMO contract. And what you get by being under the Van Berg umbrella is access to a system called Agent Pit Stop, which actually has a tool on there called Sunfire Matrix, where you can do scopes of appointments, Part D applications, Medicare Advantage applications, all in one place. You can also track all of your business by product line through the Agent Pit Stop website. So it's really handy. You get a login, and it's just a really great way to be able to see all of your business in one place. Contracting is streamlined, and there's someone there helping to make sure that everything is funneled through the process. So you're not wondering, am I ready to sell? Am I ready to go? Am I going to get paid for this business? You have somebody helping to channel that for you and make sure you stay up to date on all of your requirements. Van Berg is also great with marketing support. So once you're working with us, you can get your Agent Pit Stop account. You've got access to so many great marketing tools. So pre-made letters, pre-made postcards, approved marketing materials that you can use, different ads to make it really plug and play. You just put in your information and you're able to use that out in the marketplace. So most of us, when we're an entrepreneur, we don't have a marketing department or a contracting department or a compliance department. By working with Van Berg, they can help support us in all of these ways. Sometimes we have to get paper applications. Van Berg helps us with all of the processing. So instead of trying to remember 10 companies, different fax numbers, right to one place, and then Van Berg's team actually helps us to make sure all those applications get through and approved. If there's any problem, they're letting us know so that we can make sure we're getting credit for our business, and it frees us up to have more time to sell. And then IT support as well, just making sure that you're having everything that you need to be able to successfully sell. So Black Point comes in as a managing general agency to really help you with local market support, helping you to strategize in your marketplace. What counties do you want to target? Is there a segment you want to look at? Are you wanting to have help with paying for marketing support? So things like direct mail or social media ads. How do you want to support your business? And we can partner with you on that and help to finance some of that for you. We also help with business planning. So what are the different cycles in terms of retaining your business, growing new business? How do you want to tackle your market? What are you going to do with local area marketing to help grow your business? Also training. Today's an example of that. We're working on selling skills for the next couple of months. So just learning different tactics for how to be more successful, because if you have opportunities out there, you want to make the most of it and grow your business as much as possible. We also have a CRM tool, which is a tracking of all your client information. We use Salesforce. If you work with Blackpoint, you'll have access to that CRM tool, to lead share, all those kinds of things under our organization. And really just helping you to build your business, to retain your business, to grow by referral. All those things are what you can look forward to working with me and working with the Blackpoint team. So let's jump into what's today's hot topic. Commercial is over. Please feel free to work with us. Reach out to reservations@blackpointinsurance.com. Send an inquiry on our website, blackpointinsurance.com. We're happy to get in touch with you. Also want to encourage you to follow us on Facebook, also on LinkedIn, as well as on YouTube. That's free access to all of our trainings, and we're always here to be able to support you. Now, if you have a question, I just want to remind you that you can put it in the chat box. We are going live on YouTube, so we're not taking live questions, but if anything pops up, go ahead and put it in the chat. So let's jump into what you came to hear about today. Pregnant pause for a little sip of coffee there. So the first thing you want to think about is before the seminar even begins. So location, location, location. Just like real estate, location really matters when it comes to conducting an in-person webinar. You also need to decide if you want to do webinar over the computer or if you don't want to do seminar face-to-face. What are you good at? Do you build that relationship better locally? Are you good online? Are you able to engage people? What's going to really work for you? Once you're choosing a face-to-face scenario, you want to make sure there's good handicapped access, that it's clean, hopefully a private room if you can get it, what kind of refreshments you're going to provide, how much that's going to cost. If you're doing it online, what online tools do you have available? If you're doing it face-to-face, is there parking? Is there bus access? Location matters to make it easy for your potential clients to attend, right? You want to make it simple, easy to do, convenient, and in their neighborhood. Then you also need to be thinking about compliance. So before you even start, right, you've found your location, you've secured it, you need to decide if it's a formal event, meaning you're going end to end with the presentation and taking applications. Is it informal? You're setting up a table and providing materials. You need to file the event with each and every carrier that you're planning to represent. Every carrier has different timelines for filing those events, and it's really, really important that you get that done in advance. Now, with the Van Berg and Blackpoint relationship, we can help you to file those events. We can provide a template, and we can help you get those to all the different carriers in one stop. So it saves you time and frees you up to do more selling. When it comes to the events for compliance, you always need to attend and show up. Sometimes we see that our events are not as successful as we want, and people tend to want to not show up to those. You have to show up because they've been filed, and Medicare can be sending secret shoppers to those events to attend, and you don't want to get dinged from a compliance standpoint. Also, we can provide you at Blackpoint a compliance checklist, as will all the carriers, of all the things you need to make sure you cover, star ratings, different components to make sure that those are always covered in each and every presentation. So by keeping a checklist, that's going to really help you. In the event that an event does need to be canceled, there are very specific rules around cancellation. One of the things is that if it's canceled in short proximity to the event, you have to market the cancellation in the same way you marketed doing the sales seminar. So really, really important. Always important, even in the event of a no-show, that you stay for at least 15 minutes to make sure that nobody attends. At sales events, remember, it's a distinction on sales events, both formal and informal. At sales events, applications can be taken, benefits and premiums can be discussed, and scopes of appointments are not required at formal or informal sales events. On educational events, you can provide a business card or gather a scope of appointment, but you're not allowed to discuss benefits and premiums. You can't take applications. So be sure that you're filing them correctly. For today's purposes, we're focusing more on a sales formal or informal events and the different rules associated with those. So make sure you file them appropriately so that you can take applications and discuss benefits. Now, also before the seminar, you've got to think about materials. So here you're seeing, you can create a material, you can send it to a plan sponsor who sends it to Medicare to get approval. I like to leverage Van Berg to help me with this. I don't want to be creating my own marketing materials. I don't have the time or capacity or the team to support creating my own marketing materials. So I rely on Van Berg. If there's something that I need that they don't have in their library of materials, which is pretty rare, they'll help create it for me. They have a marketing team and they do a great job of creating those materials for me. So they handle all of this process and help deliver the finished product so I'm able to market. The other thing that I want to think about is when I'm presenting, I always use carrier approved materials. So if they have a carrier approved seminar presentation, I'll use that. Or if I'm discussing a plan specifics, I'm going to use their summary of benefits, already approved materials that I know are going to make sure I stay out of compliance jail. And I also provide the best possible information to the people who attend. So really, really important. Also, have a checklist, all the things that you need to make sure that you cover and incorporate those in a natural way in your meeting, making it fresh each and every time you do the meeting. Also, before the seminar, you have to decide how you're going to market to people. They're not just going to show up. You need to do different things to get people to attend, of course, in a compliant manner. You always want to use carrier-approved marketing, leveraging your upline like Van Berg. You want to consider budget and also cost share. So for instance, with Blackpoint, I have funded several different marketing campaigns, done 50-50 co-op. So just putting together a good plan, and I can help you with that, figuring out what you'd want to do. Am I going to do direct mail? Am I going to do flyers? Am I going to focus on certain zip codes that are around the venue? Am I going to do social media marketing? Am I going to do local area marketing where I distribute flyers to senior centers and community centers and doctors' offices, putting those in their common areas? Sometimes you're going to do a surround strategy that draws in all of those components. So depends on your budget and your strategy, but just getting that going can be a big deal. The other thing is you can create a referral pipeline. So one of the things that we've done at Blackpoint is we have so many happy and satisfied clients that they're recommending people come to us all the time. And we're always directing them right into a sales seminar to make sure they're getting that good overview of the information. So just really key and important, especially when you're going to be discussing benefits and you want to have the opportunity to take sales, that you're filing those events, that you're marketing them appropriately, and doing different components, different surround strategies to get as many people attending as possible. Now, probably one of the biggest things, and people who've been to my webinar trainings have seen this guy before. So this little guy, he prepares. Look at him. He's covered in his flippers and he's got his goggles. He is ready for action. And that's what you need to do when you're going to be conducting a seminar yourself. And so many people try to wing it. And I have seen so many people be unsuccessful. The winging does not work when it comes to getting prepared for a sales seminar. What I recommend, especially when you're new, is writing out the entire presentation. Yep, the whole thing. Take the time, write it out, exactly what you want to say in the way that you want to say it at the times that you want to say it. And then what you're going to do is you're going to take that written presentation and you're going to practice it again and again to make it natural, to make it your own. I always say mirror time, literally going in front of the mirror, seeing what your facial expressions look like, practicing the information, making it so solid that you feel so confident and comfortable with the information. That's the preparation that it takes. A lot of people will tell me I can't do presentations. And all that means to me is that they have not wanted to put in the time to prepare to get comfortable, because anybody can do it if you practice and put the time in. So really, really important. Once you've written out the entire presentation and practiced it 100 times, so you feel comfortable with it, you've seen how you look in front of the mirror, now it's time for video. Get someone you trust, like an upline partner like me, to video you. And also surround yourself with other key brokers and agents that can give you feedback right on the spot. Here's where it went well. Here's what could be improved. Here's where you maybe missed a compliance step. Here's where you could position that information or tell a story a little bit better to get that point across, right? So video feedback, watching yourself, there is no replacement. Getting comfortable with Q&A. Repeating the questions, reframing the questions so it really positions answering that in a way that works more broadly for an audience. All of those are key things, and we'll have future trainings on how to handle Q&A and how to position that to make you more successful in your meetings. But the practice is what's key. Videoing, see yourself, Be prepared to take feedback, modify, correct. The other key thing that I always recommend is be prepared when you're writing that out to tell a story. Anybody can pull out a summary of benefits and say, this copay, that copay. Your potential prospects can read. They can open the summary of benefits and do that. But when you tell the story and put them in the position of being a member of the plan, that's what's key. So picture this, it's the first of the year. You're going in for your routine physical. Here's what you're gonna pay. You're gonna present your health plan card. They're gonna see your ID card. They're gonna collect this copay and you're gonna be on your way. Next step, you're probably gonna go to the lab and here's what your experience is going to be. So put them in the shoes of actually being a member of the plan and your chance for success ups quite a bit. And it also is more interesting to listen to, preparing and telling stories, examples. They really make a difference in terms of the presentations you deliver. Also, before they arrive, you want to be thinking about how are you going to be successful when you get to that meeting. One of the things that's just the worst is when you show up to a venue and they're not ready for you, right? They forgot you're coming, or worse yet, your potential prospects are calling the restaurant to see if an event is happening and they're acting clueless. They have no idea. So be sure to consider calling the venue 1 week prior, reminding them that you're coming, make sure you're on the reservation book. Say you haven't directed people to call them, but if they do, let them know you'll be there at that day and time, and then do it again the day before. I'm coming, I'm gonna be there a half hour early. Here's how I want my setup to look. Here's the snacks I wanna order. All those kinds of things. You can be prepared and ahead of that before the meeting even begins. If you want to be successful, you've got to really prepare ahead and be ready for success, delivering that when you get there. So really, really key. Once you get to the venue, I highly recommend being at least 30 minutes early. You want to build a rapport and relationship with the waiter staff, whether it's a waitress or a waiter, letting them know, here's what we want to order. We want a pot of coffee ready. We want some iced tea. We want some glasses set up. And of course, being mindful of COVID, individually wrapped snacks at their places, whatever the case may be. But you don't want interruptions once they get there. The last thing you want is your meeting begins and everybody's going around to a one-on-one ordering. You're just doing snacks, have it set up in advance, and you're really set up to hit it out of the park. You also want to set up little stations for the people as they attend. So what I recommend is you've got the marketing materials you're going to be reviewing. On top of that, you have your Medicare approved lead card, which we can provide you, which is optional for people to complete. But if it's sitting out, most people will complete it. It does need to say that it's optional. A pen, any tchotchkes or giveaways. You've got your hand sanitizer or whatever it is that you're distributing. Have that all set up for them. Make sure there's proper signage for your location. If you're in the back, have a sign at the front of the restaurant saying that you're going to be there or whatever the venue is, directing traffic of where you need to be. Just think of these things in advance so it makes it easy to do business with you, easy for people to find you, easy for people to be comfortable, and really minimizing interruptions, because it's really hard to get your point across if people are yelling, hey, coffee, or across the restaurant, that type of thing. You want to make it easy on yourself. Also, you really need to think about snacks. So one of the reminders for sales events is that you cannot provide meals, coffee, hopefully healthy snacks, iced tea. You can do chips and donuts like the picture suggests, but the whole idea is that it's snack things, not a full meal. You're giving them a slice of pizza or a burger, you've gone too far. It's against compliance rules to provide a meal. And snacks are quite candidly a lot more convenient to provide. You can easily set it up in advance and avoid interruptions, which is key. You want to control the flow of that meeting to make sure you have an opportunity to secure leads and to gain sales. So that's going to be really your goal, and you have to think about what you're trying to do here. I also recommend when you think about snacks, either have it already pre-set up at their seats or have a refreshments table that they can grab and sit down. And again, avoiding interruptions and making it seamless and easy for you. Also, a thing that you want to think about at events is that you can't have gifts valuing greater than $15. So the combination of your tchotchke and the pen and everything like that needs to below $15. You can do gift cards as an incentive to come in within limits. It's not supposed to be big box stores. It's local kind of organizations that you can provide small gift cards. It can't be convertible to cash. You have to offer it to everybody in attendance, but I would recommend keeping it small. You don't need to have huge gifts, just little tchotchkes, have a nice organized setup that makes people engaged and wanting to do business with you. So before we jump into them arriving and getting on with additional training, I just want to remind everybody that the chat box is open. If you have a question, you can put it into the chat. Want to encourage all of you to like and subscribe to my YouTube channel. You can see this training and many others and have direct access to all of that and be able to really get yourself growing on your business. So it's game day. It's time for your sales event. They arrive. You've got to greet them. I can't even tell you how many trainings I personally have attended where the host or hostess is busy sorting their papers. They don't even say hello to me. I'm not sure I'm in the right place. Manners count. Hello, nice to see you. Maybe we're not shaking hands or giving hugs anymore, but we can definitely say hello, welcome. I'm so glad you're here. Make them comfortable that they're in the right place. You wouldn't invite people over for a holiday and not say hello and greet them or ignore them while you're cooking in the kitchen. You would say hello and greet them and make them comfortable. The same goes when you do a seminar. You want to make sure people are comfortable, invite them to get a snack, introduce yourself, ask their name, explain what to expect. Hey, there's a station over here with your information. If you have time, please fill out that welcome card so I can get to know you a little bit better. You're engaging them right from the get-go, and people buy from who they like, right? And so if you're greeting them and being friendly to them and making them comfortable, your likelihood of gaining a new member or client has just increased. Now, one of the biggest things that I think is an important tactic at a sales seminar is what I call pre-selling, right? Now, really what it is information gathering. So you're trying to probe to understand the current situations of all of your group, right? So how do I get more information about them? If they're filling out their lead card, I tend to get right there next to them, saying hello, introducing myself. Oh, what plan are you on? Oh, okay. We've had a lot of people in that situation come to our meetings and this is what they liked about what they're going to hear. I think you're in the right place. Or I had trouble with my current plan because I don't have access to a certain doctor or prescription. Well, okay, let me make sure I take that into account and find options or alternatives that are going to work with your needs. So you're probing to understand what's going on with them. Maybe you're in open enrollment and a plan is exiting the area. Oh, okay. We've seen a lot of people come in whose plan is leaving, but good news is I have an alternative that works with your same group of doctors. So you're tailoring it before you even begin speaking at the event. You're tailoring the event to their needs. You're assessing their situation. You're gathering more information. And I literally call this a pre-sell because you're putting them in the shoes of buying what you're selling because it's appropriate for their situation. If you don't ask questions and do that probing, you won't know if it's appropriate for their situation. You're just a talking head, right? So you want to get to know them and understand the scenario that they're in and really know up the front if there's people who are potential buyers. Sometimes people are just coming and they're not potential buyers, but by assessing their situation, you can figure out who really needs to make a change, who's appropriate, what's their scenario, and how do I customize my presentation to meet their needs. One of the things that I also like to do that's a really best practice is, especially if they're willing to fill out the lead card, of course it's optional, but most people do because they want you to know them and they want you to follow up. They already like you because you've built a rapport and relationship. Noting if they're interested in an MAPD plan, the doctors and prescriptions they take, documenting all of that so you can follow up. Also, if they're just interested in a drug plan, the names, the dosage, the quantity of the prescriptions they take, pulling all that information together is going to make it easier to follow up either that day or later on. So really taking that information into account, getting everything you need to really ultimately bring them to the next step. Super critical. Now, the sales event has to have an agenda in the flow. So if you've done a good job in your pre-work, writing out your entire presentation, you've already got a flow. You know what you want to talk about and when. You have a good introduction laid out. You're talking about who you are and what you do, why it's important to work with you versus others that are available, what you're going to talk about that day, the order in which you're going to talk about it. And then for those who's it's appropriate, you're going to go ahead and take enrollments today. It's okay to say this is a sales seminar. If it's appropriate for you to buy, this is an eligible time frame for you to enroll, and I'm here to take your application today. So just setting it up that it's okay. This is what we're going to be doing today, and really going through that agenda so they can follow. Okay, this is the introduction. Here's the rules of the plan. Here's the key components of the benefits. And now it's time to ask questions and talk about enrolling. So just kind of going through that, organizing the flow. Practice is everything. One of the things I recommend as you're presenting is to gain agreements as you go. So, wow, this plan offers unlimited worldwide emergency travel. Wouldn't you agree that's a great value? If you're planning to travel, that's a good agreement that you can gain. Isn't that great? Wow, that's amazing. You've got to tell a story, right? Don't be boring. Don't just read every different component. You want to be able to tell a story. Put them in the shoes of using the plan. Avoid superlatives. That's a CMS compliance. You can't say this is the best. This is the most amazing. This is the ultimate plan you can get. You've got to avoid those superlatives. Incorporate your compliance checklist, but don't do it in a boring way. Like, let me get my checklist out. Boom, boom, boom. No, you're going to incorporate that at appropriate times. So when you're talking about Part D, you're going over things like the star ratings. You're going over all the basic Medicare design of that. You're talking about prior authorization. All those components, you're making sure I've got my checklist and I've covered everything that I need to cover. The question and answer, as far as I'm concerned, a lot of people get nervous around Q&A, but I feel that when you get Q&A, that means people are engaged in what you have to talk about. But be sure to repeat the questions so the entire audience can hear. And I recommend reframing questions so that people understand what you're trying to get across. So what you're saying is I have to have a gatekeeper if I'm on an HMO. So the question is there a primary care physician involved in this plan, and how does that work on a Medicare Advantage plan? So just kind of reframing that so it gives clarity, helps everybody broadly understand, takes away negative energy and flow from the question and repositions it appropriately so you can give an answer. Always give examples where people can see themselves using the plan. Let's say it's the first of the year and you go into the doctor's office, you're using your ID card, you're paying your copay. Let's say you're on a cruise, anybody going on a trip, tell me where you're going, something happens, here's how you're gonna leverage and use that plan. So just really positioning it and examples of them actually using the plan is big. Mini close as appropriate. So again, mini close, gain agreement, those are synonyms, right? So do you see why a lot of people like this plan? Do you see why, can you see a value in having eyeglass coverage with your plan when original Medicare doesn't cover that? So just asking questions, gaining agreements, getting them nodding really helps you to solidify a relationship and potentially a sale. And then always talking about next steps and timing. If this works for you, I can take your enrollment today. The effective date will be January 1st. If you're going to be new to Medicare next year, the next step is us connecting at XYZ point. Let's talk about that timing and next steps to help gain agreement and get people to the next step in the process. Enrolling on site. If it's a sales event, you do have permission to enroll on site. A lot of people do a wonderful presentation and then avoid taking enrollments at all costs. It's a sales meeting and people are coming there oftentimes because they're ready to enroll. If they don't enroll with you, you might do a great presentation and then they go home and enroll over the phone with someone else, not you. And guess what happens? No credit, right? So you want to go ahead and take these enrollments on site. Also, best case scenario, even if they don't enroll on site and still want to work with you, that's a whole separate appointment that you have to take. It may not be necessary. Some people do need more time, but a lot of people are ready to buy, and you need to be ready to accept those enrollments right on site. As long as they've got a valid election period, either an SEP or it's AEP, you can take those applications on site and process them right away. Remember, if you enroll someone on site at a sales webinar or sales seminar, you don't need a scope of appointment. Okay, so scopes of appointments are for individual marketing appointments. You don't need it for a pre-advertised sales seminar, but you do need to document on the application how you got that application or document it in your CRM tool, just in case someone asks you later why you didn't get a scope of appointment. Always make sure you're using that sales and marketing checklist, you're accepting an enrollment, make sure every component that needs to be gone over is, so that person's walking away with the appropriate materials and with all the information they need to assure they've made a great decision. Always check every doctor, every prescription. It's not enough for them to say, oh, all my doctors are with XYZ medical group. Yep, I'm going to check just to make sure you're going to have easy access on the carrier website to make sure those doctors are available to you. For your prescriptions, the names, the dosage, the quantity, the preferred drugstore, and you'll be able to communicate what those copays will be by looking up each and every medication. It's really important to set new client expectations. Okay, everything is going through for your January 1st effective date. You can expect within 1 week to know if you're going to be approved. Within 10 business days, you should have your new ID card. Here's what's going to happen with your old plan, or if you need to make a cancellation. Set those expectations and next steps to make the experience positive and to assure not only that you got a new client, but that you retain that client in the long run. Now, what happens when they don't enroll on site? Well, after all these great tips, they probably will, but sometimes it's just not appropriate, or they have more questions, or they want to invite a son or daughter to listen in on the information. When you want to do a one-on-one marketing appointment after the meeting, remember, you have to get a scope of appointment for that one-on-one meeting. So really, really important to document all the products you plan to discuss in the scope of appointment. It is okay at the sales seminar to take the scope for the next meeting, to even book when that appointment will take place. You want to make sure that you do that. Make sure that they're prepared for that meeting so that you have your best chance of enrollment. Make sure you have your Medicare card there. Make sure that all of your prescription information is sent to me in advance so I can do a preview for you on all of that information when I get there. Walk them down the path. Decide if it's going to be face-to-face or virtual or phone call. All these things need to be considered when you're going to do a one-on-one marketing appointment. Make sure you get the scope of appointment and that you keep it according to scope of appointment guidelines. So what about those scope of appointment guidelines? Remember, a scope of appointment is a permission slip for a one-on-one marketing appointment. Remember, you need to document in advance all of the different products you would discuss in a scope of appointment. You actually have to keep those scopes of appointments on file for 10 years. If you're working with Blackpoint and Van Berg, that's really easy to do because we have the online Sunfire Matrix tool, which will store them all. Save you the paper and the hectic nature at your office. You can do it all online by text or email, super easy. Also, some carriers ask that you submit a scope of appointment with the enrollment. Sometimes they will just ask for a copy of it at a certain point down the road. So having easy access to that is very keen and easy to use. The other thing you should know is that if you get to the appointment and they want to discuss something that's not originally documented, you do need to get a new scope of appointment, and then you can continue that conversation. So really, really important that if you're going to do a one-on-one marketing appointment following a sales seminar, you're going to need to get a scope. Now, a lot of people, especially during COVID, moved to virtual seminars, webinars, and you really need to decide, what if I want to do virtual meetings? Is there different things I need to consider? And there certainly are. You have to consider the platform. Are you going to use Google, Zoom? It's really, really important that in advance of those webinars, you make sure people know how to log in, that they've got the link, that they've practiced, that they can get there. You can't just show up 1 minute before. Either someone on your team who's helping you needs to get on early, or you need to show up early to make sure everything's going smoothly and everyone can get in. Encourage guests also to arrive early so that you can begin right on time. Clear your workspace of clutter. I have mixed results with that. Make sure it's not messy, that people are seeing a nice workspace behind you. Make sure you have a good microphone so people can hear you. Know how to share your screen so you can share a presentation like I'm doing here and people can also see you. Take Q&A in the chat box or live. You can take questions, but just have certain pauses throughout the meeting where you pause, gain agreement, make sure people are okay, and ask them to questions. Also, I encourage people to mute their lines when they're not speaking because there can be a lot of background noise when everybody is from their homes, you know, whether it's someone cooking in the background or watching TV or listening to the radio or flushing the toilet. It's definitely not things you want to hear when you're having a virtual sales seminar. So with that, I think we've done a pretty good overview of how to conduct a successful sales meeting. If you have more questions about this, I encourage you to reach out to me. You can go to my website, blackpointinsurance.com. You can email us at reservations@blackpointinsurance. You can call the local office. I really encourage you to subscribe to my YouTube channel, Blackpoint Insurance. You can see this training and many others. We also feature our Medicare Minute, which is a weekly Medicare education piece. We talk about entrepreneur. Every week I do an Erin the Entrepreneur segment that talks about how to grow your own business. We do these broker trainings. We do This is 65, which is an innovative show where we meet with people who are doing great things, side hustles, entrepreneurs. doing great things out in the community. So please like us on YouTube. Also, you can follow me on Facebook and LinkedIn. I really encourage you to do that. So we appreciate your time today. You were wonderful. If there's anything I can do to help you grow your business, please be sure to reach out. My name is Erin. Thanks so much. Have a great day, everybody.